Thank you so much. Hello, hello. Think I have to. It's good here. I was busy, sorry. You will pass the exam, definitely. Keep tapping. Thank you so much. Everybody, please keep tapping. Then we will start. Use 4 paths in an option. Okay, so another example. This is how we prioritize our questions or answers in exam. So rule number 1, modifying phrase is key. Always remember this part. Modifying phrase is key. So in this question, examiner will ask use 4 parts in option. What are those? Age, gender, diagnosis, and modifying phrase and diagnose. So this is, I just give the example how the question looked like. 5-year-old female is suffering from dash dash dash. 25-year-old female suffering from dash dash dash. Okay, so another example. Person. Keep tapping, guys. Thank you so much. If anybody is new here, please just follow my page. Okay, so person is having heart attack. Okay, so vitals are stable. So now, which one is diagnose and what is the modifying phrase here? What kind of? Everybody please comment your answer. Person is having heart attack, vitals are stable. So what is the diagnose and what is the modifying phrase here? Diagnose is heart. Okay. Broad. Diagnose is heart attack. What is the modifying phrase then? Okay, so most important is modifying phrase. So yes, heart attack is diagnosed. Vital are stable is modifying phrase. Vital sign stable, modifying phrase is stable. Yes, this is modifying phrase. After we will do some questions like prioritizing questions, phrase. Okay. So one more example. Then we will do rule number 2. Person is having chest pain, BP 180, respiration 32. Okay, so what is the diagnose here? Diagnose and modifying phrase. Everybody please participate. If anybody new here, just follow my account. After the rules, we will do some questions. Okay, so here, chest pain, diagnosis, chest pain, blood pressure, heart pressure, modifying phrase. Yes. Okay, so this is, yes, diagnose. This is modifying phrase. So this was our rule number 1 for prioritization. Modifying phrase is key. In these question, examiner will ask age, gender, diagnose, and modifying phrase and diagnose in the question. So these are some examples. Now we are going to do prioritize golden rules So rule number 2, prioritize acute over chronic. So here ABC is trap. So now you have 3 patients. Those are COPD, chronic heart failure, and appendicitis. But according to rule, which patient should be on the prioritized list? Which patient is on our priority? COPD, chronic heart failure, or appendicitis? Everybody please comment your answer. According to rule, nurse J. Yes. So according to the rule, appendicitis. Very good, guys. Yes, appendicitis is priority. Sandra by COPD. Yes, appendicitis is priority. Okay, but if you follow ABC in prioritization, you may follow COPD. But according to the rule, appendicitis is priority. Now rule number 3. Rule number 3. So here, time frame is essential. Okay, so here, fresh post-op is priority over the medical or surgical condition. Okay, so always less than 12 hours is high priority. If anybody wants to take a screenshot, rule number 1, rule number 2, you guys can. This is our rule number 1. Everybody got it? Rule number 1 and rule number 2, or should I repeat? Everybody got it? Rule number 1. Rule number 2. Okay. Repeat. Nelly got it. Thank you. Which one? Rule number 1 or rule number 2? Okay, so I'm going to repeat one more time. Then we will... Rule number 1, repeat. Circulation, airway, breathing, and mostly for patient that is unresponsible. Then it's... Okay, so rule number 1 here is modifying phrases key. In these questions, examiner will ask or use 4 parts in an option. Okay, sorry. Use 4 parts in an option. So what are the 4 parts? Age, gender, diagnosis and modifying phrase, and diagnose. So example, this is the example how you will see the question in your exam. 5-year-old female is suffering from dash. 25-year-old female suffering from dash. And another example. Person is, okay, so this is another example. Person is having heart attack. Vitals are stable. So now diagnose is heart attack, but modifying phrase is vitals are stable. So this is the modifying phrase. You always, okay, this is most important. You have to look for the modifying phrase. Vitals are stable, but he has a heart attack. So number 2 example, person is having chest pain, BP 100/80, respiration 32. So this is the diagnosed chest pain and this is the modifying phrase. Always go for this modifying phrase. So now rule number 2. Rule number 2. Okay, so prioritize acute over chronic. Always go for acute disease, not for chronic. ABC is trap. You have 3 patients, COPD, chronic heart failure, and appendicitis. So now according to the rule, so appendicitis is on priority, not COPD or chronic heart failure. Appendicitis is priority. But if you follow ABC in prioritization, then you may follow COPD. Next, rule number 3, time frame is essential. Fresh post-operative is priority over medical or surgical condition. Less than 12 hours, most important. Less than 12 hours is our high priority. If anybody is new here, please follow my account. And then I will post this whole lecture on my YouTube channel. And next. Yes, rule number 4. Can you apply those description later? Yes, for sure. Marie, yes. Okay, so next. Rule number 4. Everybody please keep tapping and thank you so much. So rule number 4. Prioritize unstable over stable. Thank you, Brad, so much. Everybody, please keep tapping. And then, how you know patient is unstable? modifying phrase, condition, vitals. Okay, so here, stable, unstable. It's chronic illness. Keep tapping, guys, please keep tapping. Then acute illness. Next, post-op, more than 12 hours, patient is stable. Post-op, less than, everybody please comment your answer, less than. Post-operative client, less than. Keep tapping, guys, keep tapping. Less than 12. Yes, less than 12 hours is higher priority. Local anesthesia. Then general anesthesia is unstable patient. Priority. Yes, and then lab values. Most important, lab values. I will discuss these lab values, like which patient should be on our priority list according to the lab values, maybe in next live lecture tomorrow. Lab values. Level A and B are the stable patients. We will discuss which patient come under A and B. Yes, C and D unstable. Yes, so lab values of level C and D are unstable patients. We will discuss both tomorrow, and then blood urea nitrogen 10 to 20 is stable patient. WBCs increased or decreased are unstable patients. Please come live every day until Saturday so I can refresh my mind load. Yes, for sure. Okay. Next, HP up to 12 is good, less than 12 abnormal. Maya, yes, what do you mean by A and B and C and D? We will discuss in another lecture. I will tell you what lab values come under A and B and what comes under C and D. Hi everyone, hi, hello. Okay, so next. Okay, HB up to 12 is good, but less than 12 is abnormal. But HB less than 8 is severe and comes under unstable. If anybody is new here, please follow my account. And next, increased creatinine. Spelling might be wrong. Creatinine is stable. Okay, CO2 up to 59 and comes under C. So under C, value C. Okay, this is okay. CO2 up to 59 comes under C, and C is also unstable, but more than 60 is D, means respiratory failure. Respiratory failure. If CO2 in their 60s, then it comes under value D and respiratory failure. Next, sodium. Increased or decreased as patient is stable without change in consciousness. Keep tapping, please keep tapping, guys. Thank you so much. And next, (80-100) comes under C, and O2 less than 93 is also unstable. My hands are ready to take a screenshot. Go ahead, guys, go ahead. Then I'll turn page. Okay, so okay, INR more than 3. Yes, one more. Okay, I'm going to write down here INR more than 3 is patient is unstable. And one more, I'm going to write down here potassium. Even decreased, even increased, patient is unstable. So this is a rule number. Prioritize unstable over stable patient, or how you know patient is unstable. So this is the patients we categorize: stable, unstable, chronic illness versus acute illness, post-operative, more than 12 hours patient is stable, less than 12 hour patient is unstable. Here they have few normal values ranges in the NCLEX design. Local anesthesia patient is stable. General anesthesia patient is on our higher priority and patient is unstable. Value level A and B, we will discuss tomorrow what comes under A and B and what comes under C and D. So 1, 10 to 20 patient is stable. WBCs even a point fluctuation. Even in in potassium, even a point fluctuation, patient is on our higher priority. WBCs even a mild like decreasing, increasing, patient is unstable. HB up to 12 is good, less than 12 is abnormal. HB less than 8, severe. Creatinine increased is stable. CO2 up to 59 comes under C, more than 60. What time tomorrow? 2. 8 p.m. Alberta timing 8 p.m. Please everybody keep tapping. Okay, so next, Sodium decreased or increased, patient is stable but without changes in consciousness. Here, CO2 up to 59C, more than 60D, respiratory failure. It can cause respiratory failure. Next, INR more than 3, patient is unstable. 8 p.m. Alberta timing. What time tomorrow? Alberta timing. Please, guys, keep tapping. Everybody keep tapping. Thank you, guys. Next. Stable. Do you guys want to take a screenshot? Then you guys can. There. Everybody got it? Okay. So next. Unstable. So next, stable patient is ready to discharge. So unstable patient, newly admitted. Or patient admitted longer than 24 hours. Okay, so expected. So patient with meningitis having 102 Fahrenheit temperature is expected. Don't take it as an unstable patient. Patient with meningitis having 1.102 Fahrenheit temperature is expected. And here, unexpected. Patient with ulceration colitis having 4 temperature is unexpected. So this is unstable patient. Okay, so some golden rules here. Okay, some golden rules. Okay, four things. Everybody, please keep tapping, guys. Always priority, regardless expected or not. Can I take a screenshot? Rule number 5. Or just rule number. Love your writing, Jeet Tammi. Thank you so much. Thank you. So okay. Wait, give me a second. Here, rule number 1. If anybody wants to take a screenshot, you guys can. Rule number 1. Rule number 2. Rule number 3. And then rule number 4. Stable versus unstable patients. Okay. All good? Keep tapping, guys. Keep tapping. Thank you, Brad, so much. Let me see rule number 3. Okay, there you go. Rule number 3. Thank you, Carly. Thank you. Big A, thank you so much. Okay, so here, rule number 4. Rule number 5, please. Rule number 5. No, I have only rule number. I just discussed only 4 rules here. These are just the general things you have to keep in your mind. Golden rules. 4 things always on priority, regardless, expected or not. Number 1. Pulselessness. Pulseless. Although it happened in VFib. The one you just wrote. Okay. Yeah, this one. 2. Hemorrhage. It can happen in hemophilia, but don't confuse with bleeding. Number 3, fever. Over. Why? Because risk of seizures. Hypoglycemia. Blood sugar. Less than 70. Number 5. Necrotic pain. Necrotic pain can damage. I think these rules are already on my page and the video has been pinned already. You guys can check. Organ. So these should be on our priority list. Okay, so next. Okay. We will do one question here. Just one question, one or two maybe. Question number 1. Which patient? Don't say, is it an easy question? Should the nurse? I know who gonna say it's an easy question. Nurse assess first. I know you. Okay, so A, patient with acute pancreatitis falling asleep in bed. I'm so tired from being up studying. Titus and blood pressure 92/58. B, patient with COPD who is, I'm gonna complete this later, or no, confused and agitated. C, a patient with GI bleed and melena. D, a patient with low sugar is more critical. Patient with pulmonary embolism on heparin. On heparin, reporting chest pain. Okay. D. Okay, so patient with pulmonary embolism on heparin reporting chest pain. This hard. Okay, so everybody please comment your answer. That's hard one. Yay. Who? Okay, D. Why D? Why D? Okay, we will break down this later. First I want to know A. Okay. D, A. Please guys, please like reread the options. Reread the for BP. It's between A and D. Okay. C. C, patient with GI bleed. Okay. As BP isn't very low, right on the, okay. That's what I thought, but it's D. B. B. Who said B? Michelle. Okay. Anybody? Okay, let's break down. Very good job, Michelle. Appreciate it. So the right answer here is B. Why are you guys not thinking about this? Should be on our priority list. Confused and agitated. Whenever you see confused and agitated in your option, close your eyes and choose the answer. Go for it. Is it new confusion? Doesn't matter new confusion or what. If you see confused patient, go for it. Go for it. Okay, I consider all are these are like dangerous, right? But confused and agitated. Okay, we will break down it. Keep tapping, guys. Keep tapping. Thank you so much. All I need is your tapping. You got me. Yeah. I don't want to hurt that it is an easy question. Okay, so we will break down. Or even, okay, give me a second. I think B, but me confused. Okay, patient with COPD is equal to CO2 retention, means respiratory failure. Patient getting confused here, right? Patient with COPD who is confused and agitated. COPD means C2, CO2 is retaining in body, right? Retaining means respiratory failure. Respiratory failure. Like others are already being treated or compensating. Okay, I'm gonna tell you now. I get it. Okay, now I'm going to tell you here one more thing. Keep in your mind for your exam mental status change is equal to early hypoxia. Early hypoxia. Okay. Everybody got it? Yes, get it. Thanks. Okay. One more question. So always think about patient with COPD who is confused and agitated, means CO2 is retaining in our body and it can cause respiratory failure. Mental status change is equal to early hypoxia. Keep tapping, please, guys. Keep tapping. Thank you so much. If you liking this lecture, just keep tapping. Okay, so next, one more question. Hope so. Okay, so question number 2. Which patient is priority? All the best. Everybody, please pray for everyone who have an exam. A patient with DKA. If anybody is new, first time in my life, please guys follow my account. Okay, so a patient with DKA and blood glucose 480 mg DL. B, a patient with stroke 3 hours ago with slurred speech C, a patient with sepsis and urine output 20 ml per hour. D, a patient with asthma receiving continues nebulize. Nebulizer. Okay, so what's your answer? Everybody comment your answer. Broad B. Patient with stroke 3 hours ago and slurred speech. Okay. C. Sing B. 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 Angela Redpure. Who said C? Shake. User. Okay. A. It is A. Okay. Patient with DK and blood glucose 480 mgdl. B. C. Leo Jason Singh. Broad. Everybody please comment. Ash C. The stroke one because we don't have much time to save him fast. Okay. DCBA. Christine. That's good. What's the answer? It's A. Okay, guys, we're gonna break down this. And the right answer is... Are you guys ready? Okay. B, because they need to treat with TPA within a certain amount of hours. Stroke is my threat. Okay. Threatening. What's your answer, by the way? I didn't see your answer. Texan. Christina is too much confused. Yeah. Okay, so the right answer is... Okay, so right answer here is C. Whoever said C, Ash, good job, appreciated. So the right answer is C. Patient with sepsis and wait, what? Oh my god. Patient with patient with sepsis and urine output 20 ml per hour. I can't anymore. Okay. Okay, I'm gonna break down the... Wait, see here. Low urine output, always keep in your mind. Low urine output. Oh God. Yes, my answer is right. Good job. Low urine output is equal to poor perfusion. Okay, always keep in your mind because what 20 ml hour is normal. No, 30 ml per hour is normal, Bella. 30 ml. Always keep in your mind 30 ml. Less than 30 ml is priority. That's true. So low urine output is equal to poor perfusion. Keep in your mind. Okay, so one more question. Then we will do priority and delegation rules. We will do priority and delegation rules. Yes, one more. Yes, one more. Okay. So question number 3rd. Okay. Question number 3rd. Which patient requires immediate intervention? Just give me a second, please. Okay, so which patient requires immediate intervention? A. BP 88 by 60 after receiving antihypertensive. Antihypertensive. Then option B, heart rate 132 with anxiety. C, respiration 24 with pneumonia. D, SpO2 92% with chest pain. Okay, so what's big A? Yes. Okay. Okay, thank you. D, Hasi. D, Diljit Bands. C. If anybody is new here, please follow my account. B. Keep tapping, guys. Brad. Thank you so much, Brad. B. Good job, Texan. Your answer is right. So the right answer is A. Sing, good job. Right answer is A. BP 88 by 60. C. After receiving antihypertensive. After receiving antihypertensive. Heart rate 32 with anxiety. With anxiety. Respiration 24 with pneumonia. SpO2 92% with the chest pain. Okay, so now BP 88 by 60. Okay, let me break down this. Why? Medication induced hypotension. ADBC. Hypotension is equal to iatrogenic shock. So others are compensating. Others are compensating. So rule is sudden change chronic abnormalities. Everybody got it? Or should we go for one more question, or then rules, tiebreaker rules? Priority and delegation tiebreaker rules. Or you want me to do one more question? Please keep tapping. One more. Okay. Okay, then one more. Yes, one more, then delegation. Okay. Please keep tapping. Thank you so much. Yes, please. Thank you. Thank you. Okay. So one more question. Okay, so question number, I don't know which question number is it, but which patient should the nurse assess first? Keep tapping, please keep tapping. A patient with anaphylaxis. Thank you so much, Brad. Anaphylaxis and hoarseness. Yes. B, I will post this whole lecture on my YouTube channel. A trauma patient with BP 78/40. C, a patient with asthma and wheezing. D, a patient with pneumonia and fever. Easy. Give me a second, please. Easy. Okay. Good. Easy. Who said I'm going with A? A patient with anaphylaxis and hoarseness. A trauma patient with BP 78/40. I'm going A. B, big A, and B, okay. B, airway is equal to A, B. No. Big A and Texan. Whoever said B is the right answer. Good job, guys. So right answer is B. Okay, so we are going to break down. What? Why? Angela, I said B. Yes, good job. Oh, C means circulation. Okay, so let's break down. Why? I understand hoarseness is equal to airway threat, but not obstructed yet. So BP 78/40 is equal to shock now. I'm not ready. Okay, so rule. Actual collapse beats potential collapse. Everybody got it? One more question. Okay, So this is how it, Angela, what happened? Shock and death. Yes, Sahiba Kaur. Sahiba Kaur. Nice name. Yes, lol, we will never be done. BP drop and death. Thank you, Brad. Thank you so much. 80. Keep tapping, guys. Keep it. One more question. Or tiebreaker rules. I think one more question. So this is how it works. See, trauma patient with BP 7840. So patient here. Yes, please, please. Okay. Rule: actual collapse beats potential collapse. So whoever is new here, please follow my account. So next question. I answered one question correctly only. Ready or not? I will. Definitely, you will pass the exam. Definitely. Next. I just choose these questions only for you. These are little bit tricky questions, but just understand the... If you follow the rules, you will pass the exam. Thank you so much, user 3474. Okay, so next question. Which patient is the priority? So A, post patient who is drowsy. B, a patient with meningitis who need an entire day of just answering priority questions. A patient with meningitis and stiff neck. C, a patient with head injury and vomiting. D, patient with chronic Parkinson's tremor. I think that's how we are gonna get it. Where you post on your YouTube channel? Yes, I will post this whole lecture. Can be a few pharmacology would be great. Okay, just guys, please comment what next question you want me to do. So we will do that questions like on which unit? C, B, C, a head injury and vomiting. Please guys comment your answer. Please. C. Hi Sarah, how are you? Red pure. A. Why A? Please write down your rationale. Please. I want to know your rationale. Why A? A and B are expected finding and D is chronic. Brian. Okay. Yes. Good job, Brian. Yeah, so C word chronic. It's not our priority. C equal ICP. Yes, good job. C is the right answer. I'm gonna discuss here, okay? So vomiting after vomiting after head injury is equal to increased ICP. Others are expected or stable. So means rising ICP beats infection signs. Intracranial pressure, I got one. Hope you guys like this lecture. Please everybody keep tapping, and next we are going to do, let me check if I have more questions. Okay, one more question. I just gave my NCLEX exam. Divya, I love you. I love you too. I just gave my NCLEX exam. You will pass. Okay, so one more question, then we will do tiebreaker rules. Oh my God. Question. Which patient can the nurse safely see last? Just give me a second. Let me bring my water. You passed the exam. Sorry. Divya. You got more midwife questions. Not yet. There. I just gave exam. Okay. So you're waiting for your result. So which patient can the nurse safely see last? Option A, acute pancreatitis. With hypocalcemia. B, stable angina controlled with nitroglycerin. Acute versus unstable versus unstable Oscar. New onset atrial fibrillation with RVR. D, pulmonary embolism on oxygen. Okay, so C, new onset BSN student. Acute versus chronic. Okay, so please read the question carefully and then answer Ashkar. It seems like every answer's right. B, C, the answer is B, stable angina controlled. User 780YCB, too easy. Hard to select. Yes, last. Yes. So the right answer is no. B is the wrong answer. Oh, I'm sorry. You said C last. Yes, that's why I pointed your comment. C last. OMG. D. Pulmonary embolism on O2. BSN student. Are you sure? We killed the patient. Oscar. BSN student D. A. Mahira. D. Oh my god. I understand who said B, but I don't understand who said A, C, D. I'm working, sorry. It's okay. Big A, D. Are you sure? This is serious. B is clearly stable and controlled nitro. Okay. Big A. I don't know. I said all of them. D. Oscar, D. Okay, so the right answer is B. Stable angina controlled with the nitroglycerin, so patient can see this patient last. It's not B, you said. Oh, I was just kidding. No kidding. B is the right answer. Yes, I said B. Yes, B is the right answer. Stable angina controlled. Oh, sorry, big A. Controlled with nitroglycerin. I just gave the rationale. Okay, so why? Controlled plus stable. Keep tapping, please. So, others are actively unstable. So rule is equal to controlled disease is equal to lowest priority. First would have been C. Priority. If the question is different, which patient can the nurse see first? Then what? D, C, Brad, C, Tina, Divya, C, D, Saiba, D, why D? Pulmonary embolism on O2. Yes, so the C is the right answer. Always look for new onset. If your option saying new onset, go for it. It's okay, Saiba. Okay, go for it, okay? And then now we are going to do priority and delegation rule, tiebreaker rules. We are done with the questions. Oh my God. Thank you. I have exam in 2 days. Everybody please pray for ਤੁਸੀਂ question ਘੁਮਾ ਦਿੱਤਾ mind ਵੀ ਘੁੰਮ ਗਿਆ. Okay. So priority and delegation. Tiebreaker rule. Oscar, you will pass the exam. Everybody will pass the exam. Just follow the rules and keep practicing more than 100+ questions per day. I'm loving it. Make sure you guys do 100 plus question practice, and the boot camp is best software. Boot camp is best software. Make sure in one day 100 plus questions in one sitting. Okay, so next tiebreaker rules. Okay, so first, the vital, the organ, the vital, the organ, the vital, the organ, higher the priority, higher the priority. Too much difficult. Highest priority. Try will do. Thank you will do it. Which software? Boot camp. Oscar, you got this. Believe in yourself. Come back here to let us know. Brain, heart. Yes. So vital the organ, higher the priority. Most important here, I am talking about organ of modifying phrases, not the organ of diagnosis. So most important organs. ਦੀ ਤੁਸੀਂ ਡੇਲੀ ਕਿਸ ਟਾਈਮ ਲਾਈਵ ਹੁੰਦੇ ਆ? ਕਾਰ ਜੋਹਲ 8 p.m. Alberta timing 8 p.m. ABC airway breathing circulation heart. Okay, so most important organs. Number 1. So what is the number 1 organ? Number 1, brain. Brain, heart, lung, kidney, liver, pancreatitis. Brain. Number 2, lungs. Number 3, heart. Number 4, liver. Number 5, kidneys. Number 6, pancreas. Pancreas. Okay, so example. 23 years, heart failure, having potassium 6.2 with no changes in ECG. 2, chronic renal failure, creatinine 2.7, pink frothy sputum, overload हो गया Savacor. Pink frothy sputum, And option number 3, patient acute hepatitis. After this, we are done. We will continue this from tomorrow. Having jaundice, unable to arouse, number 4, patient having, if anybody having any question, just direct message me with yes, if you have any inquiry, just direct message me. Patient having brain surgery 8 hours ago, dissatisfied staff service. So what's your answer? Can you pin your YouTube channel? I can't find it. Okay, did you check my bio? Harman Sandhu for off. Follow the rule. Texan, follow the rule. Please follow the rule. A, number 1. You mean number 1, right? 3, car clear. Patient acute hepatitis having jaundice, unable to arouse. Everybody please comment your answer. Answer is A, Sahiba. Are you sure, Sahiba? Just read the question again. And follow the rule. Yep, number 1. Okay, good. D then. Harman Sandhu 3. A has no charts. 4. 1. Everybody keep tapping, guys. Keep tapping. Thank you so much. Okay, so we will... Okay, follow the rule and look where brain is affected. In which option brain... Which question is related to brain? Three. Oscar 3. 4. Not arouse. Harman Sandhu, good job. Okay, so the right answer is number 3. Why? Because brain is number 1. So unable to arouse. Look for this. This is just to divert your mind. Patient acute hepatitis or having jaundice and unable to arouse. Unconscious. So if you guys saying brain is on number 1 priority, so unable to arouse. So this is the right answer here. Means hepatic encephalopathy. Got it? How about potassium? 6.2. We are looking for a priority here. So brain is affected, right? Brain. And hepatic encephalopathy. We are just following the rule. Okay? Oh, yes, ma'am. Next is ask graph. Hope you guys like this. If anybody wants to take a screenshot, you guys can take a screenshot. So now I already gave an example here. So next we are going to do ask graph. Please. Oh God. What? No, I'm tired. Okay, so next ask graph, then we are done. Ask graph. Follow the rule. If there is rule, follow the rule. Ask graph. So A stand for A stand for airway. Shortness of breath. Number 2, drooling. Use of accessory muscles. Stridor means silent chest. Okay, so S stand for sepsis. If anyone is new here, just follow my page, please, and I will post the whole lecture on my YouTube channel. Okay, sepsis, fever more than 'K' stand for, thank you, Brad, thank you so much, appreciated. K, changes in potassium. Even a point fluctuation. G stand for glucose less than 70. R stand for grunting. Potassium is king. Yes, grunting while feeding. A stand for altered mental status. Confusion, disoriented, restlessness. Then P stand for peritonitis. Severe peritoneal infection. H stand for hemorrhage. Or BP less than 90. Okay. If anybody wants to take screenshot, you guys can. Tomorrow we will do the lab values and priorities. And we will do some more questions. Then we are done. Questions. Can you tell me what time? Divya, 8 tomorrow, 8 p.m. Alberta timing. You're welcome, Brad. Thank you so much. 2 hours. How do we use the ask graph? Or 2 hour, I'm not sure. Where are you? Sorry, I'm an inventor. Is 8 p.m. is your fixed timing for every day? Not fixed time. Anahit. Okay, which patient should the nurses have patient with heart failure? Okay, we'll do some more questions, then we are done. Priority and delegation. Okay, so questions. Hope you guys follow the rule. Question number 1. Keep tapping. Please love your handwriting. Thank you so much. So, which patient maybe this is our last question. Then tomorrow we will do the lab values and some other questions, maybe case study. We'll see. Which patient should the nurse assess first? Keep tapping, please. If I see glucose lower than 70 and someone who is restless, would I go first? We will do that question too for sure, Anahit. A patient with heart failure who report sleeping on 2 pillows instead of 1. B. A patient with COPD who missed 1 dose of inhaled corticosteroids. C. A patient with diabetes who's keep tapping, guys, who's fasting glucose increased from 120 to 160. D. A patient with chronic kidney disease who report decreased appetite. Okay, so what is your answer? What is your answer? CCB. Patient with diabetes whose fasting glucose 120 to 160. Okay. Sarah C. Okay. A. I think C. Harman Sandhu. I think. Are you sure? C. Michelle. Harman Sandhu C. Michelle and Jojo. Good job, guys. So the right answer here is A. A patient with heart failure. Red pure. Good job. C because condition change. Okay, Harman Sandhu. A patient with heart failure. We will break down it. What? Deep Amrit A. Oh wow. Yes. So a patient with heart failure who report sleeping on two pillows instead of one. Okay. So we are going to break down this. All are here subtle changes their life. My answer is right. Good job, good job. Keep tapping, please. My answer. Okay, so orthopnea progression is equal to left-sided failure worsening. My answer is right. Left sided failure worsening. So others reflect expected fluctuation. Not trajectory. So what is the rule here? Trend. Larry Queen, thank you so much. Thank you so much. So, trend that affects oxygenation. One more or that's it? I'm sorry. Beats metabolic drift. Everybody got it? One more. Big A. Kamal, tap kar. Okay. Give me a second, please. to speak with the provider. UAP report patient refused breakfast. Situation required the nurse delayed allegation. Safely see last. Which patient should the nurse assess first? Okay. So another question here. My phone went off. How do I assess the ones who had before? So this is our last question. Tomorrow we will do the lab values and priority and some more questions. So this is our last question. Which patient should the nurse assess first? Which patient should the nurse assess first? Question mark. A patient with sepsis whose heart, please, I see the previous page. This one? Keep tapping, everybody. Please keep tapping, guys. Thank you so much. Okay, so next, a patient with sepsis whose heart rate decreased from 118 to 96. B, a patient with pancreatitis who report pain is gone suddenly. C, a patient with asthma who needs albuterol once this shift. D, a patient prioritization. B, patient with pregnancy who report pain is gone suddenly. Okay, a patient with pulmonary embolism whose respiration rate decreased from 30 to 22. So what is your answer? Harman Sandhu B, Anahit B. Okay. Larry Queen B. April Maria B. B. Okay, so the right answer is B. Why? Because of this. Suddenly gone. So here the rule, unexpected improvement in severe disease is equal to red flag. Always keep in your mind Saibakar, because pain is gone. Yes, suddenly. Pain is gone, but suddenly. So unexpected improvement in severe disease is equal to red flag. Yes. Yes, gemstone. And okay, so we did today. Here, golden rules for prioritizing. So we just gonna review this again, then we are done. Just got to gift gemstone. Okay, so we did golden rules today. So prioritization rule number 1, modifying phrase is a key. In these questions, examiner will ask 4 parts in an option. So those 4 parts: age, gender, diagnosis, and modifying phrase. And diagnose, everybody please keep tapping. Example, 5 years old female is suffering from dash. So this is the example how you will see the question in your exam. 25 years old female suffering from dash. So here example, person is having heart attack, vitals are stable. So heart attack is here diagnosed. We will follow the rule. Heart attack is diagnosed and vitals are stable. This is modifying phrase that is most important for the question. Person is having chest pain, BP 100/80, respiration 32. So diagnosis chest pain and modifying phrase here is BP 100/80 and respiration 32. Your answer is depend on your modifying phrase. Next, rule number 2, prioritize acute over chronic. ABC is a trap. You have a 3 patient here, COPD, chronic heart failure, and appendicitis. So according to the rule, appendicitis is priority. But if you follow ABC in prioritization, then you may follow COPD. Rule number 3, time frame is essential. So means fresh post-op is priority over the medical or surgical condition. Less than 12 hours. So less than 12 hour is high priority. So prioritizing golden rules. Rule number 4, prioritize unstable over stable. How you know patient is unstable? So these are the stable patients, these are the unstable patients. Chronic illness, stable. Acute illness, unstable. Post-operative, more than 12 hours. Post-operative, less than 12 hours. Local anesthesia is stable patient. Journal, it's unstable. Lab values, we will tomorrow do these lab values, what comes under A and B and what comes under C and D. So lab values, A and B is stable patient, C and D is unstable patient. BUN 10 and 20 is stable patient. WBCs, even decreased, increased is unstable patient. Potassium, even a single point, even a single fluctuation in potassium is a unstable patient. HB up to 12 is good, but less than 12 is abnormal. HB less than 8 is severe, unstable. Then Leo Jason, thank you so much. And then creatinine, even increased, is stable patient. CO2 up to 59. Okay, if carbon dioxide up to 59, then it is come under C lab values. So means it is unstable patient. Or more than 60 comes under D and cause respiratory failure. Next, without changes in sodium, even increased, decreased, without changes in consciousness, it's stable patient. And here O2 less than 93 is unstable. INR more than 3 is unstable patient. Then stable patient. Patient is ready to discharge is a stable patient. Patient admitted longer than 24 hours, stable patient. And unstable newly admitted patient is unstable. So what are the expected? Patient with meningitis having 102 degree Fahrenheit temperature is stable patient. And here, patient with ulceration colitis having 104 degree Fahrenheit is unstable patient. Then we did some journal golden rules. Here, 4 things always priority regardless expected or not. Always should be on your priority list. Number 1, pulseless. Although it happened in VFib, this should be on your priority list. Thank you so much. And next, hemorrhage. Although it can happen in hemophilia, don't confuse in between bleeding or hemorrhage. Fever over 104 degree Fahrenheit, risk of seizures. Hypoglycemia, blood sugar less than 70. Necrotic pain can damage organ. Compartment syndrome. So, okay, we did some questions here. Which patient should the nurse? I think. Okay, so next we did priority and delegation tiebreaker rules. The vitals, the organ, higher the priority. More important, I'm talking about organs of modifying phrase, not the organ of diagnosis. So, most important organs here: number one, brain; number two, lungs; number three, heart; number four, liver; number five, kidney; and number six, pancreas. So, we did some examples here. We follow the rule. Okay, you have a patient, number one, 23 years, heart failure, having potassium 6.2 with no changes in ECG. Always reread the options and reread the question. CRF, chronic renal failure, creatinine 2.7 and pink frothy sputum. Number three, patient acute hepatitis having jaundice but unable to arouse. So number four, patient having brain surgery 8 hours ago, dissatisfied with staff service. I don't care. So number three is our answer. How to get those notes? I will post this whole lecture on my YouTube channel. So number three is the right answer. Why? Because brain is on number one priority. Unable to arouse related to brain means hepatic encephalopathy. So this is our right answer. And then we did ask graph. A stand for airway, means shortness of breath. I don't care either. Moments. How are you? Okay, so A, airway. Shortness of breath, drooling, use of accessory muscle. Stridor means silent chest. S stand for sepsis. Fever more than 104 degree. K stand for changes in potassium. G stand for glucose less than 70. R stand for grunting while feeding. A, altered mental status. What comes under confusion, disoriented, and restlessness? P stand for peritonitis, severe peritoneal infection. Good, thank you for asking. And H stand for hemorrhage, BP less than 90. Then we did some questions and we are done for the day. Tomorrow we will do lab values and priorities. I think I have something here to show you guys. Not this one. What time tomorrow? Tomorrow, if anybody wants to take a screenshot of this, you guys can. Tomorrow 8 p.m. Alberta timing, 8 p.m. If anybody is new here, just follow my page and follow my YouTube channel. I will post the whole lectures. I think I have some lectures over there. We did psychiatric, we did cardiac, we did respiratory, we did endo, we did the maternity, and next, what else? We will do pharma. Next, we will do pharma. Just follow my YouTube channel. And I think I have... I'm so confused in between Eastern or Pacific. I don't know, but I am in Alberta, Calgary. Just check the time. Shukriya. You're welcome. Okay, if anybody, I think I already posted. Can you please go back to the first page, please? For sure. I just want to take you guys a screenshot of this. So then we are done for the day. See you tomorrow. See you guys. See you. Okay, this one here. Just take a screenshot. Oh. Now I'm tired. Thank you so much. Okay, so next, if anybody is new here, follow my account and follow my YouTube channel. The link is in the bio. So these are the some delegation rules. Do not delegate what you can eat, means evaluation, assessment, and teaching. Eliminate answer with yes or no questions. Most important. Comma, comma, and rule. So all parts of the answer must be correct. Pay attention to words such as priority, first, best, initial. Assume you always have an order. Read the question and the answer you choose before clicking next. Do not too quick the answer. Familiar questions, always carefully read and understand questions before answering. Okay, so these I already just mentioned. Strategies to use NCLEX: expector versus unexpected, chronic, acute, stable. I don't see all. Maria, these are here. Just take a screenshot, please. Then next, drainage types. No. No, these are most important. Take a screenshot, guys. Sign off. These are the hallmark signs like McBurney, Cullen, Turner, Babinski. Just take a screenshot. And these are here. Good. Oh, okay, there you go, guys. There, gemstone. Give me a second. Here. Now take a screenshot of this. Nav Seni. Welcome, welcome. अगर प्लीज़ किसी ने नहीं हजे तक मेरा अकाउंट ਨੂੰ फॉलो ਕੀਤਾ प्लीज़ फॉलो कर लो. And also my YouTube channel. Now I am tired. Perfect. Thank you. Okay, this is here. Take a screenshot. Did you post all notes on YouTube also? Yes. Navsani, yes. And next here. Most important, the third most important drug for the exam, heparin. These are the infection prevention. We will do this for sure in next lectures. Yeah, priority delegation. These. And my YouTube channel is in my bio. Just go and check. So these are the priority delegations, RN, LPN, UAP. Okay, so this is what I want to show you guys here. ECG recognition. If anybody wants to take a screenshot, then we will discuss it later in like another lecture. So just take a screenshot for ECG. Abnormal ECG. Give me a second. Oh. I already posted this lecture. The ECG, it's on my, what country time? Canada. Canada timing, and check for Calgary time. Calgary or Edmonton. So I have this whole lecture on my YouTube channel and on my TikTok channel. And I already posted on my Instagram account. Please follow my Instagram too. I will post link. I think I have a full lecture on my YouTube channel. Next, hallmark cardiac system. I think if anybody wants to take a screenshot for this, we will do this when we will do the ECG. Keep tapping, please keep tapping, guys. Most important. I think I already posted this on my channel. I'm not sure. What's your YouTube channel? It's in the bio. Link is in the bio, or just search Harpreet Mandir 3 something. I will repost that. Most important. So this is like, okay, hyperkalemia or hypokalemia. If you don't know the sign and symptom, just follow the rule. C. Kalemias do the same as the prefix, except heart rate and urine output. For example, if potassium level is more than the normal value, so means increased, all the body sign symptom will be high increased, except heart rate and urine output. Okay, so now we are done for the day. See you guys tomorrow. Yes, Alberta timing 8 p.m. Hope you guys liked this lecture. Thank you so much. This was very helpful. Thank you, everyone. And new here, love it. Thanks was, oh, hi, Tina, how are you? Oh, it's okay. You have these notes. I know, Tina, you have these notes already. I am new here and this was helpful. Send me that notebook. Okay, for sure. Just send me your address. I will send you the notebook. We will do this for sure. I'm jealous, Tina. If anybody wants notes, please just direct message me on TikTok. And don't forget to follow my account and my YouTube channel as well as my Instagram channel. Sure. Thank you. All I need is just followers, and I reached more than maybe 5K on TikTok, and my target is 10K. So please follow my account. Okay. So thank you. What's that? What's the YouTube channel? I will post the link, but it's already. Kamal, tu dand kate kadde ya? In my family to become RN. Jashan. ਜ਼ਰੂਰ ਕਮਲ ਤੂੰ ਦੰਦਗਾ ਤੇ ਕੱਢੇ ਮੈਂ ਦੱਸ ਕੇ ਕਰਨੇ ਨਹੀਂ ਹੈਗੇ ਮਾਈ ਅਦਰ 3 ਸਿਸਟਰਸ ਆਰ RN ਗੁੱਡ ਕੋਈ ਗੱਲ ਨਹੀਂ ਜਸ਼ਨ ਤੁਸੀਂ ਵੀ ਬਣ ਜਾਓਗੇ I searched for the name and still couldn't find it. Just try to search at the rate Harpreet Mandir 3. It's my YouTube channel. Kamal, tu pagal ya. Thank you so much. Okay, so take care, guys. See you guys tomorrow with new rules, new tips and tricks. Thank you. Can you link it here? Okay, let me check if I can do it. Oh, no, I don't know how to do it. Give me a second, please. What time tomorrow? 8 p.m. Alberta timing, 8 p.m. I think how I can pin here. Setting comment. It's at the rate, or just write it down. Okay. Harpreet Mandir 3. So I'm going to pin. Okay. So now this is my YouTube channel. Screenshot click करके लगा दे अगे मैनू पता नहीं किद्दां करना है वो स्क्रीनशॉट किद्दां लावां तू नहीं कर सकदा तैनू मॉडरेटर बनाया आ मैनू नहीं 8 PM मैनू ईस्टर्न वैस्टर्न दा भी नहीं एक पता लगदा हैगा किहड़ा आ कमल तू देख I'm new and this helpful. Thank you so much, Maria. एक मिनट रुको. Okay, so Harpreet Mandir 3. Yeah, this is my YouTube channel. Please follow. कमल देखी जे स्क्रीनशॉट लगदा होया तां तू पोस्ट करके मैनू पता नहीं किवें लगना इत्थे just give me second. Love your teaching. Thank you. If anybody wants to join my classes, then you are most welcome. But those are paid. Same profile as the one on TikTok. I think yes. Thank you so much. I learned so much today. I need an NCLEX coach. If anybody wants to join our classes, you can join my class, but those are paid. But these live lectures are free of cost. If anybody having any inquiry, please direct message. Where can we join Gemstone? Yes, please. So you guys can direct email me. My email is in the bio, the TikTok bio, my email ID. So just direct message me for inquiries. How can I join the paid one? Just direct message me, or even on TikTok or even on my email. Then we will do all the theory plus tip and tricks for NCLEX exam, like case studies, questions. Same I am teaching in like live lecture, same as in my other classes. So we will do all the units again. I mean, we will complete the all units. Kamal hoya ke nahi? Did you guys find the YouTube channel, or should I post a screenshot here? Okay, good job. How much is it join? Just direct message me to complete the course. 3 months. 3 months for the whole syllabus. Yes, I found it. Okay, guys, okay. I just messaged you. Okay. Okay, guys, see you tomorrow. Aman Broad. ਕਿਵੇਂ ਹੋ ਤੁਸੀਂ ਕਿੱਥੇ ਸੀਗਾ ਤੁਸੀਂ ਦੇਖਿਆ ਲਾਈਵ ਲੈਕਚਰ ਅਮਨ Navgil, no, sorry. Only RN. Okay, bye. Okay, bye. See you tomorrow. पूरा नहीं देखा. Okay, कोई चक्कर नहीं. Okay, late see. हाँ ठीक है. See ya. Thank you. Okay, guys. So see you guys tomorrow. Yes, Anita. Yes. Bye. See you. Bye. Take care. Good night. See you guys tomorrow. I just subscribed. Thank you so much, Empowerment. Mariam, thank you. Okay, guys. Bye.